There are two kind of classes of antibodies that are now being studied in major phase 3 randomized registration trials. One is a type of antibody against CD47. So this is a signal in macrophages, and what these antibodies do is basically they reactivate them. An example is Magrolimab. There are others. But in frontline, phase 3 study known as ENHANCE is studying azacitidine with this compound known as Magrolimab, that is a CD47 antibody against azacitidine alone. That study is accrued almost, I believe, over 80% of the patients, and we are very excited about the prospects of some type of immune therapy in high-risk disease. The other antibodies known as Sabatolimab, this blocks something called TIM3. It's an interesting epitope that is present in stem cells, maybe also in some bystander cells. And there are a number of clinical trials in phase 1, phase 2, and phase 3 known as stimulus that are studying the role of this particular TIM3 inhibitor in patients with myelodysplastic syndrome. What I think is interesting is that overall, my experience is that these compounds are not very toxic. And one could actually start thinking about perhaps even triplets, where you see combination with an HMA, BCL2 inhibitor with one of these antibodies. So we'll have to see what happens there.